Hi, my name is Nicole. Welcome to my channel, Travel to Money. In this video, I'm going to help you navigate healthcare in Spain, talk about my recent visit to a hospital here, what you can expect as far as cost, and also how you can best navigate finding healthcare during your visit. If you are new here, I have created this channel to help you learn about how to travel, adventure, and have fun on the road to financial independence. I have traveled the world, I own a couple of houses in Spain, and I would love for you to subscribe and join me on this creative journey. I am back in Spain for a few weeks, and this time I've had to learn the ropes of medical care, which is not something I've had much experience with before. As I expected, it has been far less hassle and less expensive than medical care in the US, but that shouldn't be surprising. Spain often ranks in the top 10 countries in the world for healthcare, especially when it comes to efficiency. Well, what does that mean for you as a traveler here? I'm going to talk about costs and coverage if you are a non-resident. If you do apply for residency here at some point or any sort of long-term visa, the government will require you to purchase private healthcare coverage in Spain, which is usually less than $100 per month, but may depend on several factors. In a lot of European countries, you will have public or private healthcare. For example, there will be one hospital that is public and another hospital that is private. Generally speaking, the public care is less expensive and provided by the government, where the private hospitals are a little more expensive and possibly a little fancier. In both cases, the care tends to be excellent, especially in comparison to the US. It's kind of funny. I'm a relatively healthy person. I'm not on any regular medications and I don't have to visit the doctor very often. But as luck would have it, I've actually had to see a doctor in France, Portugal, and now in Spain as well. And as unfortunate as that is, I couldn't be more happy with the care I've received, thanks to the governments in these countries not being paid off by something like the American Medical Association in the US. It's not just about insurance being affordable, but the healthcare itself is affordable because it's not been allowed to become a big box of greed like it has in the US. And this latest experience in Spain will prove my point. Not that everything here has been perfectly easy to navigate. Well, let me show you. A couple of days after I arrived in Spain on this trip, I began having shooting pains on the back left side of my skull. I noticed some tightness and pressure on the left side of my sinuses, jaw, and ear. I was like, great, I've got an infection. But the pain on the back of my skull was something that made me nervous because I've never experienced that during an infection before. In France, you can actually visit a pharmacy, and depending on your needs, the pharmacist can often give you medications that don't require a prescription. But I wasn't sure what would be required here. I went to a pharmacy and purchased some ibuprofen. There were 40 tablets. Each one is 600 milligrams, and the whole box cost me less than €2. And if you think that's a sign of how cheap healthcare can be here, you would be right. I asked the pharmacist about the infection, and she told me I would need to see a doctor. Later that same day, I went to a different pharmacy to get my friend some cold medicine, and that pharmacist did give me some ear drops to help until I could see a doctor the next day. Now, in my small town of Pago, we have a couple of clinics. I had been to one of them before to get a COVID test, but this time I started at the other one. I believe this was a public clinic. The woman at the counter asked if I had some sort of card. I believe this is what a resident would have that shows they are covered. I told her that I didn't have a card, and at first she said, "You will have to pay," as if I wouldn't want care because I have to pay. I said, "Yes, that is fine, I will pay." But then someone else at the counter told her that I would need to go to the other medical clinic in town, which was the one I had been to before. Honestly, I don't know what the rules are, but it felt a little bit like they just didn't want to deal with me. I'm not sure. Maybe that was correct, but I would have rather just paid for the services than having to go from place to place. So they sent me on my way to the private health clinic, which fortunately was just one street over. This is the one I had been to for my COVID test before. They were very kind, but when I explained my problem, she said I couldn't be seen there because I needed to see a specialist. I was pretty frustrated by this because it was fairly obvious I had an infection and needed an antibiotic. Not only that, but to see a specialist, I would need to go to a different city. Now, maybe she's right. Maybe a general doctor is not allowed to treat ENT conditions, but it felt like once again I was just being passed along because no one wanted to deal with me. She was very nice though and provided me with phone numbers and names of other places I could visit. I ended up doing a little research on my own and decided to find a private hospital in Denia that has ENT services. I knew that Denia is a very touristy town and that they would be used to dealing with tourists. I sent an email to the private hospital but ended up just making the drive rather than waiting to hear back back from the email. When I arrived at the hospital, I was greeted at the reception area right away, and there was someone there who was able to speak to me in English. They had me fill out a couple of forms, made a copy of my passport, and had me wait in the waiting room, which had coffee, tea, and water available. They let me know that the ENT was not available until the following week, but that a general doctor would be happy to see me. If only the other clinic had offered that. My wait was less than 15 minutes when I was greeted enthusiastically by a nurse who made me feel incredibly welcome and showed me in to see the doctor. The doctor was a female, probably younger than me, incredibly kind, and had excellent English speaking skills. The nurse took my vitals and I talked to the doctor about my issues. She told me that she could give me an antibiotic, but recommended I get an MRI to make sure the infection wasn't spreading to my brain or anywhere else serious. I asked her how much an MRI would cost, and she was able to tell me straight away that it was €320. For comparison, the average MRI in the States is over $1,300. Well, this was obviously affordable, but I wasn't sure I wanted to jump right into that and asked her if we could please just start with an antibiotic. She gave me a Z-Pak prescription as well as one for a nasal spray, but told me if the pain got worse or if I had a fever to come back for the MRI. My pain did get a little better, but after over 48 hours of the antibiotic, I was still having pains and was mainly nervous because the Easter weekend was approaching, and figuring out healthcare during a weekend in Spain where just about everything is closed from Friday all the way through Easter Monday. Yes, the Monday after Easter is also a holiday here. Well, I just didn't want to end up in a bad situation, so I went back. Luckily, the same doctor was there, and I was seen within 5 minutes of arriving. She called about the MRI and said she could take me there right away and would have my results by that night. We walked about a block down the street, and a few minutes later, the woman who operates the MRI machine came to unlock the building and greeted us. They were both so friendly and kind, explaining everything to me and helping me to feel comfortable. Not only was the MRI in Spain more affordable, but I also didn't have to go into a tube. It was still a little snug, but I just closed my eyes and managed to get through the 25 minutes. As the MRI finished, they walked back into the room and the doctor said, "You don't have to wait, I have your results." Fortunately, my infection was contained to one nasal cavity that was completely full. Apparently, the pain in my skull was just referred pain. The body is so interesting, isn't it? It was fascinating to see the images of my brain. The operator gave me a USB drive with access to my scans, and I paid there for the MRI itself. From there, I walked back with the doctor to the hospital, where she wrote me a couple of new prescriptions. On my first visit earlier in the week, the cost of the visit was around €90. The first prescriptions came to about €13. On the second visit, I only paid around €35, and the prescriptions came to about €20. Another thing to note about getting a prescription and going to a pharmacy, first of all, you can go to any pharmacy. The doctor doesn't have to call and give a specific pharmacy information. There will be a full sheet of paper for each prescription with 2 sections. When you go to the pharmacy, they keep the lower half of the paper and give you the upper half. You don't have to wait around like you do in the US for a bottle to be filled that has your name on it. All of the prescriptions, at least everything I have seen, is already prepared just like you would buy any other medicine box. You hand the pharmacist the prescription, they give you the box, you pay, and you walk out the door. Unless you have to wait in line, the whole thing takes less than 2 minutes. Fantastic process. All of that to say, if you have a basic problem, you should be able to walk into a private clinic or hospital and receive quality care for a fraction of the price that you would pay in the US, and this is without insurance. Some people opt for travel insurance. That's not something I do. I'm not a big insurance person in general. I find that I pay less over time when these situations arise than I would if I was paying ongoing for traveler's insurance. That being said, in the US, rather than regular health insurance, I'm part of a co-op. One of the things I love about this co-op is that I'm covered all over the world. When there is an incident or illness, I'm responsible for the first $1,000, and everything beyond that is covered, no matter where I am. If you have traditional insurance in the US, usually you're not covered once you leave the country. If you are interested in learning more about co-op health options, send me an email at info@traveltomoney.com and I can send you a referral for the one I use. Anyhow, as long as you have some sort of emergency fund that you can use, nothing here is going to be as crazy expensive with a lifetime of bills like you would have in the US. I'm a huge fan of healthcare in Spain, and I think you'll find you're in good hands here. Like this video and subscribe to join me every day where travel and adventure build financial freedom. I can't wait to see where your dreams will take you.